Hi friends, good day. Again I am back with you, Dr. Ramesh Parimi, oncosurgeon from Pace Hospital, Madhapur, Hyderabad. Well, we have been interacting about various cancers in the past 3 months, and being an oncosurgeon, I deal with mostly what we call solid tumors. So there can be various organs, cancers in the body which we treat. I, being a surgeon, operate on those solid tumors. Today I would like to enlighten you and educate you people about what is called sarcomas. It is not a common tumor, sarcoma, not a common malignancy, not a common cancer, but it is there. A good percentage of the cancers also account for sarcomas. So it is, you might have heard somebody had some kind of lump or swelling in the thigh or in the hand, and then he underwent surgery and all that. You might have heard in your circle of friends and relatives. So the sarcoma is what we call is a connective tissue tumor. Tumor means, say, let us say, cancer lump. So sarcoma is always a malignant tumor. It is not a benign tumor at all. Sarcoma means a tumor, a cancer arising from connective tissues. So what are these connective tissues? Like bone, and then a fibrous tissue, muscle, they are all connective tissues. Even blood is also called a connective tissue. When the fetus develops in the womb, after fertilization of the egg, it develops from 3 layers called germ layers: endoderm, ectoderm and mesoderm. So endoderm means the inner part, and ectoderm means the outer part, and then mesoderm means the middle part. These are the 3 germinal layers from where various organs, tissues develop. So organs like intestine, heart, lungs, brain develop. Tissues like fibrous tissue, that is fat tissue, fibrous tissue, and muscle, all these develop from the mesoderm. So the mesodermal tissues are called connective tissues in the adult, and these are called various names, including the subcutaneous fat, fibrous tissue, muscle, etc. The sarcoma can be arising from the soft tissues of the body, connective tissue of the body, like fat, liposarcoma, from the muscle, that is called Leiomyosarcoma, smooth muscle, and sarcoma from the skeletal muscle. It can arise from the connective tissue, that is called fibrosarcoma. Then it can arise from the synovial sheath, the layer which is present between 2 bones in a joint called synovial layer. The synovial tissue can develop called synovial sarcoma. Bone, also being a connective tissue, can have tumor or cancer in that called bone cancers, and osteogenic sarcoma is a typical example of a bone cancer. Well, sarcomas that develop in the peripheral limbs, like in the hand, leg, are called skeletal muscle sarcomas, whereas sarcomas develops from the smooth muscle called from the intestine or from the uterine. In the female, uterine muscle is smooth muscle is called. So the muscle tissue is a skeletal muscle and also smooth muscle. Smooth muscle is present in the viscera, like intestines, stomach, then uterus. So these are all called smooth muscles. A sarcoma can also develop from these muscles. They are called Leiomyosarcomas or GIST, that is called gastrointestinal stromal tumors. These are the various classifications of sarcomas: fibrosarcoma, osteogenic sarcoma, liposarcoma. Then from skin also there is what is called dermatofibrosarcoma. So dermatofibrosarcoma is one type of sarcomatous like tumor arising from the skin, which is fast growing. So, and inside the body, as I told you, there may be retroperitoneal sarcomas arising from the abdomen, deep in the abdomen, behind the peritoneum. That is called either liposarcoma or mixed connective tissue can be there, lipofibrosarcomas. And then there are also smooth muscle sarcomas, as I enumerated, Leiomyosarcomas. Nearly about 5% of all cancers of the body account for sarcomas. And sarcomas are present not only in the limbs, upper and lower limbs, and in the back, front of the chest and chest wall, but also in the abdomen. That is called retroperitoneal sarcomas. So sarcomas can develop anywhere in the body from connective tissue which is present all around. So ubiquitous presence of connective tissue predisposes for occurrence of sarcomas in various parts of the body, including tummy, that is called retroperitoneal sarcomas, limbs, fibrosarcoma, and osteogenic sarcoma, bone tumors, and all. Generally, what happens in bone sarcomas, the individual feels that there has been a small injury and a lump has developed or a swelling has developed in the bone, which is hard. He attributes it to that injury, some trauma, and sometimes they neglect. Even a general practitioner may overlook it, saying that okay, it's a small injury might have happened, you might not have noticed. You take these pills, you'll be better. Let us see later. But with the pills like painkillers, it may subside a little bit apparently, but not real. And that is the time when we should be careful and probe to rule out a sarcoma or confirm it. Once it is confirmed, the treatment can be initiated very early. So any swelling in the body, in the limb, which is growing fast, should be taken seriously, should be seen by a doctor, especially appropriate doctor like a surgeon. Then it should be suspected can be sarcoma and evaluated further. So depending on the site of the tumor, there are various tests to be done. The simplest test is putting a small needle and then taking out some tissue, blood mixed tissue from the lump. This is called FNA, fine needle aspiration cytology. That is the simplest, least invasive test which can clinch the diagnosis. Immediately the tissue drawn with a syringe and needle spread on the slides and put in alcohol, fixed, and the pathologist would read the slides, look at the various cells that are presented to him and determine whether the cells are sarcomatous or not, cancer or not. Well, apart from these tests, generally there are blood tests like complete blood picture and also ESR. Then there would be what is called an X-ray. Simple X-ray can see whether the tumor, which is little hard, is arising from the bone or away from the bone. Secondly, if X-ray is not conclusive, we can do a further scan like ultrasound scan, sometimes even MRI, apart from CT scans. MRI shows clearly the soft tissue shadows and whether it is arising from the fat which is present under the skin or from the muscle or from the tendon sheath or from the bone as we go deeper and deeper. So further workup, systematic way is essential. Once you suspect it can be a sarcoma, the lump which has developed can be very dangerous in due course of time. Apart from the routine tests, what I have said, there is what is also called histopathology. A kind of biopsy can be done, which is using a gun, true cut biopsy. Not only we can confirm the diagnosis by tissue diagnosis, but also do further tests called ISC, immunohistochemistry. ISC testing on a specimen submitted into the lab has become part and parcel of workup of all cancers nowadays, including sarcomas. So once a sarcoma is diagnosed, it is very important that the treatment should be started very early because they are all fast growing tumors. Sarcomas spread to different organs in the body, including lungs, sometimes brain, and by blood. So that's why, because of the blood spread, they are also known to spread fast. Not only that, they develop fast, grow fast, spread fast as well. So once diagnosed and staged by PET scan and others, to see which stage the sarcoma is, we have to proceed as early as possible to initiate the treatment. The treatment generally for sarcomas is called surgery. So once a sarcoma is diagnosed and confirmed, staged, the treatment consists of removal of that particular part, including surrounding normal tissue. That is what is called good clearance, with the cut margins being free from tumor cells. This type of local wide excision is the treatment of choice in most sarcomas. In the bone sarcomas also there can be conservative bone surgery wherein They don't do amputation or cut off the bone, but try to preserve the bone and function. But there are different techniques in that. So every decade, new techniques are coming into practice while treating these sarcomas. Those sarcomas which are very extensive and cannot be removed completely and cause a lot of tissue loss probably can be treated initially by a small amount of radiation called neoadjuvant therapy and also chemotherapy. Though chemotherapy is not very choice to be given because the sarcomas are not that very sensitive for chemotherapy, yet some of the drugs like doxorubicin or erythromycin is used in these situations to downstage the disease. So generally after a good wide local excision, if the character of the biopsy and features suggest there can be a recurrent chances are high, immediately within 3 weeks of surgery, the part has to be irradiated. Radiotherapy also becomes part of the treatment of sarcomas. So in treatment of sarcomas in surgery, the main surgery that is done is called local wide excision, including removal of the muscle up to bone, soft tissue, skin also sacrificed. Reconstruction is also very important. So the plastic reconstruction of the removed tissue space is done by plastic surgeon or those experts in this field to maintain the contour of the limb and also to give function. The functional and cosmetic value has to be kept in mind when local wide excision is done. So it's again a team of doctors who work on sarcoma patients, especially when the sarcoma is a little bit advanced, locally advanced tumor, where a lot of tissue is being sacrificed. In retroperitoneal sarcomas, it would be kind of a laparotomy like operation where they mobilize and then safeguard the important structures and remove the whole cancerous tissue, sarcoma tissue. Mainly it depends on the stage. If early stage, say less than 2 centimeters tumor is removed well and if necessary adjuvant treatment like radiotherapy is given and the patient is kept under follow-up, generally they do well. The 5-year survival rates are as high as about 72%. If the tumor is big enough and more than 5 centimeters and a lot of skin and underlying tissue is involved, the radical excision of local wide excision and then reconstruction also is attended with some risk of local recurrence. So these cases also require compulsorily, when there is local advanced disease, radiotherapy postoperatively. As I said, chemotherapy can be tried in some situations and in some centers even immunotherapy is also advocated as part of treatment of these sarcomas. So one of the oldest cancer sarcomas, but the behavior and the treatment choice are not changed much over the decades. Highly aggressive tumors which spread to the lungs especially, and lungs are when affected, bilateral both lungs will be affected. The end is not very far off. Respiratory failure and the individual succumbs to it. And spread to the other parts of the body like to brain is not that common. Liver is also not that common. But mainly lungs are involved in sarcomas, and the sarcoma spreads by bloodstream to distant parts of the body. And the prognosis is also very guarded in these cases. As I said, about the 5-year survivals in early stage is about 72%, whereas in advanced stage it is hardly 28 to 30%. Generally, sarcoma which has spread to the lungs will not give more than 6 months to 1 year for the individual to survive. And unfortunately, there are no effective drugs, that is chemotherapy, to control the disease and also to eradicate the disease, as they are not chemosensitive tumors. Now, postoperatively, all these cases have been completely treated either with surgery alone or with surgery plus radiotherapy should be kept under surveillance. Once in every 3 months, the patient should come to the doctor who is taking care of him or her, then get examined, and if necessary some tests are done to confirm that all is well. There are no chances of local recurrence or distant spread. A PET scan is advocated not frequently depending on situation, either once in 6 months or once in a year. For the first 2 years, the patient should see the follow-up under the name of follow-up surveillance is family physician once in every 3 months, that is quarterly. After 2 years, it can be, if the individual is free from disease, can be once in 6 months, and after 3 years, it can be once in a year. Then it continues once in a year for about 10 years. It is always good to be under surveillance, because sometimes we have seen late recurrences. Recurrence means again reappearing. Late recurrences are seen, even though apparently the individual is all right for about 3 to 5 years. Later it develops. So one of the worst tumors being the sarcomas, which are generally life-threatening, highly malignant tumors, of which we have to be very aware of and seek timely advice.